Part 1. Understanding trigger finger in seniors, causes and symptoms. Trigger finger, or stenosing tenosynovitis, is one of the most common causes of hand pain in seniors over 60. It often affects the thumb, ring, or middle fingers, making daily activities like buttoning a shirt or holding a spoon difficult and painful. Let's dive into what causes this frustrating condition, how it feels, and why it's so common as we age. What is trigger finger? Trigger finger happens when the tendons in your fingers, those tough bands that help you bend and straighten, get irritated and inflamed. These tendons normally glide smoothly through a sheath, but when inflammation narrows the sheath, the tendon catches, causing pain, stiffness, or a locking sensation. Many seniors describe it like this: "My finger clicks painfully when I try to bend it. Sometimes it gets stuck and I have to pry it open with my other hand. It feels like a spring releasing when my finger straightens suddenly." This triggering is not only uncomfortable, it can be scary, especially when it makes you drop things or lose confidence in using your hands. Why trigger finger happens after 60? Aging naturally leads to wear and tear in our tendons, especially in the hands, where we use fine motions every day. 1. Repetitive hand use over the years. If you spent decades doing things like typing, sewing, gardening, cooking, using hand tools or instruments, then your flexor tendons have endured a lot of micro-stress. Over time, this leads to inflammation and scarring. 2. Health conditions like diabetes or arthritis. Studies show that seniors with diabetes are up to 10 times more likely to develop trigger finger. Similarly, osteoarthritis and rheumatoid arthritis can stiffen joints and affect tendon motion. 3. Hormonal and circulatory changes. After age 60, blood flow to small tendons reduces slightly. Also, hormonal shifts can lead to more stiffness and less flexibility, especially in women. 4. Gender. Trigger finger is more common in women over 60, particularly postmenopausal women, due to hormonal and connective tissue changes. Recognizing trigger finger early. Most seniors don't realize what's happening until the symptoms worsen. Morning stiffness in one or more fingers, a clicking or popping sound when bending or straightening, a bump or nodule at the base of the affected finger or thumb, pain when gripping small objects like a pen or fork, a feeling that the finger is catching when you move it. If the condition progresses, the finger may lock in a bent position and need to be manually straightened with the other hand. When to seek medical help. If symptoms interfere with your ability to eat, dress, or do daily tasks, it's time to act. Mild cases might improve with stretches and rest, but if the finger locks often or stays stuck, professional care is essential. Here's a simple self-check. Try to make a gentle fist, then open your hand. If any finger clicks, gets stuck, or hurts, you may have early-stage trigger finger. Real-life case study. Mrs. Anna, 68, from Florida. Mrs. Anna was a retired piano teacher who began noticing discomfort in her middle finger after playing for short periods. "At first I thought it was arthritis," she said.
"But then I noticed a popping sensation every time I bent my finger."
Her doctor diagnosed her with trigger finger and prescribed gentle hand stretches and a night splint. Within 6 weeks, her symptoms improved significantly. She also changed the way she practiced piano, shorter sessions, frequent breaks, and warm-ups. Tip of the day: morning warm water soak. If your fingers feel stiff in the morning, try soaking your hands in warm, not hot water for 5 minutes. Then gently open and close your fists several times. This improves blood flow and loosens the tendon sheaths. Keep engaging with us. If you find this helpful, please give this video a thumbs up and comment on the number 1 below. What's your name and which country are you watching from? And don't forget to subscribe to Healthy Life 24/7 for more hand and foot care tips for seniors. Part 2. Daily hand exercises to relieve and prevent trigger finger in seniors. For seniors over 60 dealing with trigger finger, consistent daily hand exercises can make a huge difference. These gentle movements help keep the tendons flexible, reduce inflammation, and restore your ability to use your hands confidently. Let's walk through a complete exercise routine, simple, safe, and effective, that you can do every morning and evening. Before you begin, warm-up matters. Before doing any hand exercise, it's important to warm up the joints. This prevents strain and improves flexibility. Warm water method, 5 minutes. Fill a basin with warm water, not too hot. Soak your hands for 5 minutes. Move your fingers gently in the water, or try a warm compress. Use a heating pad or a warm washcloth on your hands for 3-5 minutes before starting exercises. Exercise 1. Finger extensions on table. Purpose: strengthen tendons and improve range of motion. How to do it: place your hand flat on a table, palm down. Slowly lift each finger one at a time off the table. Hold for 2 seconds. Lower each finger gently. Repeat 5 times per finger. Tip: keep the rest of the hand relaxed while moving each finger. Exercise 2. Fist and fan stretch. Purpose: prevent locking and improve tendon glide. How to do it: start with your fingers straight and stretched. Make a gentle fist, keeping your thumb on the outside. Hold for 3 seconds. Slowly fan your fingers out wide. Repeat 10 times. Variation: try this with your hand held up in front of your chest, like waving hello, then make the fist and open wide again. Exercise 3. Thumb to finger touches. Purpose: increase control and coordination. How to do it: hold your hand up with fingers spread. Touch your thumb to your index fingertip. Then move to your middle finger, ring finger, and pinky, one at a time. Reverse the order and repeat 3-5 times. Extra, say 1, 2, 3, 4, and back as you go to help remember. Exercise 4, Tendon Gliding Series. This sequence is often recommended by hand therapists for trigger finger relief. Step by step. Straight hand, hold fingers straight. Hook fist, bend only middle and end joints, keep knuckles straight. Full fist, curl all fingers into a gentle fist. Tabletop, bend knuckles while keeping middle and end joints straight. Return to start, open hand again. Repeat entire cycle 5-10 times. This exercise helps the tendon glide smoothly through the sheath. Exercise 5, Rubber Band Resistance. Purpose, strengthen finger extensors, the muscles that open the hand. How to do it. Place a rubber band around your fingers and thumb. Slowly open your fingers wide against the resistance. Hold for 2 seconds. Relax and repeat 10 times. Note, if your fingers feel sore or tired, use a lighter resistance band or rest. What to avoid. Forcing a stuck finger open, it can worsen inflammation. Repetitive gripping, like squeezing a tennis ball, can irritate trigger finger. Exercises that cause pain? A little tightness is okay, but sharp pain is a sign to stop. Suggested routine for seniors. Morning, after waking up. Warm soak or compress. Fist and fan, 10 reps. Tendon gliding, 5 cycles. Afternoon, before lunch or walk. Finger extensions on table, 5 reps per finger. Thumb to finger touches, 3 sets. Evening, before bed. Warm compress. Rubber band resistance, 10 reps. Gentle massage with lotion, 3 minutes per hand. Real-life testimonial. Mr. Robert, age 72 from Arizona. Mr. Robert started experiencing locking in his ring finger. I couldn't open jars or hold my coffee cup, he said. After learning these exercises from his physical therapist, he committed to doing them twice daily. After 3 weeks, he reported less stiffness in the morning, no more painful clicking, improved grip strength. He now teaches these exercises to friends at his local senior center. Let's stay connected. What's your name and which country are you watching from? If you found these exercises helpful, hit like and type the number 1 in the comments. And be sure to subscribe to Healthy Life 24/7 so you don't miss our daily hand and foot care tips. Part 3. Natural remedies and home treatments for trigger finger relief after 60 continues. While exercises are essential, combining them with natural remedies can accelerate healing and ease discomfort from trigger finger. In this part, we'll explore gentle, proven home treatments that many seniors have found helpful, with options for both daytime and nighttime care. 1. Topical anti-inflammatory remedies. Applying natural anti-inflammatory treatments directly on the affected finger can help reduce swelling and allow the tendon to move more freely. A. Castor oil massage. How it helps. Castor oil contains ricinoleic acid, which has anti-inflammatory and pain-relieving properties. How to use. Warm a few drops of castor oil slightly. Gently massage into the affected finger and palm for 5 minutes. Cover with a soft cotton glove and leave overnight. Use daily before bed. B. Turmeric paste. How it helps. Turmeric contains curcumin, which has strong natural anti-inflammatory benefits. How to make. Mix 1 TSP turmeric powder with a few drops of warm water and a pinch of black pepper. Apply the paste to the base of the affected finger. Leave for 15-20 minutes, then rinse gently. Repeat 2-3 times a week. Note, turmeric may stain clothing or skin slightly. See Arnica Cream. Available in most pharmacies and natural health stores, Arnica Cream helps with pain, swelling, and bruising. Apply a small amount to the tender area 2-3 times daily. Gently massage it in for 1-2 minutes. 2. Cold and heat therapy. Alternating heat and cold can improve circulation, reduce inflammation, and ease tension in the tendon sheath. Warm therapy. Use a warm towel or heat pad on the hand for 10 minutes, especially before exercises or in the morning. Cold therapy. If your finger is swollen or painful, apply a cold gel pack, wrapped in cloth, to the area for 10 to 15 minutes in the evening or after activity. Alternating method. 5 minutes warm, 5 minutes cold. Repeat twice. Do this especially after gardening, cooking, or any gripping activity. 3. Nighttime splinting. Wearing a splint at night can prevent the finger from locking in a bent position, giving the tendon time to rest and heal. How to do it. Use a trigger finger splint from a pharmacy or online. Choose one that holds the finger in a straight or slightly bent position. Wear it only at night for 3-6 weeks. DIY option, tape a small popsicle stick or foam to your finger using medical tape. Make sure it's not too tight. Many seniors find that after 4 weeks of consistent splinting, the morning pain and popping are greatly reduced. 4. Essential oil relief. Some essential oils have natural pain-relieving and anti-inflammatory properties. Top picks. Frankincense oil improves circulation and reduces stiffness. Peppermint oil, cooling and soothing. Lavender oil, relaxing, helps with nighttime discomfort. How to use. Mix 3 drops of essential oil with 1 tablespoon of coconut or olive oil. Massage into the palm and base of the affected finger. Best done at bedtime to relax the hand overnight. 5. Anti-inflammatory diet for trigger finger. What you eat also impacts your tendons. An anti-inflammatory diet helps reduce swelling in joints and soft tissues, including the finger tendons. Foods to include: fatty fish, salmon, sardines. Rich in omega-3s, berries, blueberries, strawberries. High in antioxidants. Leafy greens, spinach, kale, reduce inflammation. Turmeric and ginger, natural healing spices. Olive oil and avocados, healthy fats. Foods to avoid: fried foods, sugary snacks, white bread and processed flour, soda and sugary drinks. Excessive red meat. Eating well helps your whole body and your hands stay more flexible and pain-free. Storytime, Mrs. Helen, 78 from Oregon. Mrs. Helen was a retired librarian who had been living with trigger finger in both hands. She was hesitant about surgery, so she tried combining turmeric paste, nighttime splints, and daily warm compresses with an anti-inflammatory diet. Her result? After 6 weeks, I could button my blouse again without pain. The clicking is almost gone, and my hands feel warmer and more alive than they have in years. She now shares her turmeric recipe with her book club friends. Let's hear from you. What's your name, and which country are you watching from? If you found this helpful, press like and comment the number 1 below. Don't forget to subscribe to Healthy Life 24/7 for more real solutions for aging hands and feet. Part 4, Daily Hand Care Routine for Seniors to Prevent Trigger Finger Flare-Ups. Once your symptoms improve, the goal shifts to maintaining tendon health and preventing trigger finger from coming back. In this part, we'll build a full hand care routine tailored for seniors over 60. It's simple, effective, and doesn't require fancy equipment. Let's make caring for your hands a joyful daily habit, just like brushing your teeth. Morning routine, wake up your hands. Start your day with a 10-minute gentle ritual that sets the tone for flexibility and comfort. Step 1, warm water or rice soak, 5 minutes. Fill a bowl with warm water or dry rice warmed in the microwave. Soak or gently press your hands in it while flexing your fingers. Step 2, finger mobility circuit, 5 minutes. Fist and fan stretch, 10 reps. Finger lifts on table, 5 per finger. Tendon glide series, 3 cycles. Tip, play your favorite morning music while doing this. It sets a happy tone. Midday habit, lotion plus mini massage. Every time you apply lotion to your hands, which seniors should do at least twice a day, make it into a mini massage session. How to, rub a dab of lotion into your palms. Use your thumb to gently press along the base of each finger. Work in slow, circular motions. Give extra attention to the base of the affected fingers. This keeps the tissue soft, encourages blood flow, and prevents tightness. Afternoon care, protect your hands. This part of the routine is about reducing strain on your hand tendons. Do, use assistive devices, jar openers, padded grips. Alternate tasks that involve gripping. Take hand breaks every 30 minutes when cooking or crafting. Use 2 hands for heavier objects to distribute strain. Don't. Hold small items for too long, like pens or phones. Grip tightly without a break. Ignore warning signs like stiffness or soreness. Evening routine, relax, restore, reset. Wind down your day with a soothing hand routine that promotes overnight healing. Step 1, warm compress, 5 minutes. Use a warm washcloth or heating pad. Step 2, gentle finger massage. Focus on the tender areas. Use oil or lotion for glide. Massage in the direction of your finger toward the wrist. Step 3, stretch sequence, 5-7 minutes. Thumb to finger touches, tendon gliding, wrist circles. Step 4, night splint if needed. If your finger has a tendency to lock overnight, continue wearing a soft splint for 4 to 6 weeks. Weekly habit, hand strength check. Once a week, test your grip and flexibility. Can you open and close your hand fully without pain? Does any finger click or get stuck? Is your grip strong enough to hold a full mug? Track any changes. If something worsens, go back to more focused exercises or speak with your doctor. Clean hand habits. Keeping your hands healthy also means avoiding skin issues, cracks, or infections, which can aggravate trigger finger. Hand hygiene tips. Wash with gentle soap. Avoid harsh antibacterial ones. Use lukewarm water, not hot. Pat dry gently, especially between fingers. Moisturize immediately after washing. Use gloves when washing dishes or gardening to protect joints and skin. Real story, Mr. James, 80, from Chicago. Mr. James had surgery on one finger years ago but began feeling new tightness in another finger. His doctor advised daily hand care, not just therapy. He started a full hand routine. Morning soak with rice, midday lotion and massage, evening splint and stretch. Now my fingers feel 20 years younger, he shared. I can open my car door and hold my Bible again without pain. Make it a habit, not a chore. Caring for your hands can be a comforting, even joyful ritual. Light a candle. Play your favorite jazz. Involve a partner. Treat your hands like they deserve, because they've served you for decades. Time to share. What's your name, and which country are you watching from? If you're enjoying this series, press like and comment the number 1 to let us know. And remember to subscribe to Healthy Life 24/7 for more senior hand and foot health videos. Part 5, when home care isn't enough. Medical treatments and surgery options for trigger finger in seniors. While many seniors find lasting relief from trigger finger through home remedies, exercises, and hand care routines, some cases may require medical intervention. In this final part, we'll walk through the medical treatments, from mild to more advanced, so you'll know what to expect and when to seek help. When to consider medical treatment. Here are signs it may be time to consult your healthcare provider or a hand specialist. Your finger locks daily or cannot be straightened without using your other hand. Pain wakes you at night or limits daily tasks. Home treatments have not improved symptoms after 6 to 8 weeks. You notice new fingers becoming involved. Don't wait until your hand becomes stiff or permanently curled. The earlier you act, the better the outcome. Option 1. Prescription anti-inflammatory medication. For more severe pain and swelling, your doctor may prescribe oral NSAIDs, non-steroidal anti-inflammatory drugs, such as naproxen, celecoxib, diclofenac. These medications reduce inflammation in the tendon sheath, helping the tendon move more freely. Seniors should always check for interactions with other medications or stomach issues before taking NSAIDs long-term. Option 2. Cortisone steroid injection. A cortisone shot is one of the most effective non-surgical treatments for trigger finger, especially for first-time occurrences. How it works. A small injection is given near the base of the affected finger. It reduces inflammation in the tendon sheath. Most seniors feel improvement in 3-5 days. Success rate. 60-70% of seniors get complete relief after just 1 shot. For those with diabetes or multiple fingers involved, 2 shots may be needed. Tip. Ask your doctor to use a guided ultrasound to ensure accurate placement. It improves results. Option 3. Occupational or physical therapy. If stiffness, pain, or weakness lingers, hand therapy can help. What it includes: guided stretching and strengthening, splint fitting, education on safe hand mechanics. Most therapy programs last 4-6 weeks, meeting once a week with daily homework. Ask your doctor for a referral to a certified hand therapist, CHT. Option 4. Needle release, percutaneous release. If injections don't help and the finger continues to lock, your doctor may recommend a minimally invasive release procedure. What it is: a small needle is used to release the tight portion of the tendon sheath. No stitches needed. Done in a clinic under local anesthesia. Recovery time. Light use of hand in 1 to 2 days. Full recovery within 1-2 weeks. This is often preferred for seniors who want quick results and want to avoid surgery. Option 5. Trigger finger surgery open release. If other treatments fail, or if the finger remains bent despite therapy and shots, surgery may be the best choice. What happens during surgery? A small cut is made at the base of the finger. The surgeon opens the tight sheath to allow smooth tendon movement. Stitches are placed and the hand is wrapped. What seniors should know. Usually done under local anesthesia. Outpatient procedure. Go home the same day. Light use of hand after 2-3 days. Full recovery in 4-6 weeks. Most seniors regain full use of their finger and say the pain disappears entirely. Success story. Mrs. Gloria, 79, from North Carolina. Mrs. Gloria tried turmeric, splinting, and exercises for months, but her ring finger stayed stuck and painful. She received a steroid injection, which helped briefly, but after symptoms returned, she opted for a needle release. The procedure took 15 minutes and I was home before lunch, she recalled. Now I can hold a knife, turn keys, and write again. No pain. Frequently asked questions from seniors. Is surgery safe at my age, 70 plus? A. Yes, does. It's a minor procedure with very low risk, especially under local anesthesia. Most recover quickly. Q. Will the problem come back after treatment? A. In many cases, no. But some people may develop it in other fingers over time. Hand care and exercise help prevent this. And what if I have arthritis too? A. Your doctor can customize treatment to address both. Therapies often overlap. Aftercare and long-term prevention. No matter what treatment you choose, continue with a hand-friendly lifestyle. Daily hand stretches and warm-ups. Moisturizing and massage. Avoiding strain and overuse. Eating an anti-inflammatory diet. Also, follow up with your doctor or therapist after any medical procedure. Final message for seniors. Your hands are precious. They hold the memories of a lifetime. Cooking for your family, holding grandbabies, signing letters, creating things. You deserve to use your hands without pain. Whether through exercise, natural remedies, or medical care, relief is possible even after 60. We want to hear from you. If you found this video helpful, please hit like and comment the number 1 below. Tell us what's your name and which country are you watching from. And don't forget to subscribe to Healthy Life 24/7 for new daily content focused on hands and feet health for seniors.